We are on the way to surgery number 2 this morning to get this thing closed up and cleaned out. You ready to go?
Oh, yeah.
Let's do her. And here we are at the hospital, all plugged into the IV, wearing my lovely gown, and now it is just the hurry up and wait game to get this soggy armhole closed up. Check-in was at 11. Won't be going into surgery until like 4 or 4:45 or so. So we got plenty of time on our hands to chill out and relax. And really, I'm just grateful to be getting it fixed, excited to be getting it fixed, and excited because getting this incision cleaned up, fixed up, closed up, whatever you want to call it, it should allow the rehab process to continue to accelerate. Because like the biggest thing holding me up the last few weeks has just been needing to care for the incision and needing to be aware of it and needing to make sure that I wasn't doing anything that could, put me at too high of a risk for infection or do anything crazy that would potentially risk ripping it open further or doing something stupid like that. So I'm just excited to get it handled and done and cleaned up so that I can continue to move forward. And the whole idea behind getting it done today versus, waiting and seeing if it would heal was that by getting it done today, I'm placing my bet that it will be a faster process to actually get fixed than it will if I were to wait for the thing to close up from the inside out. And even if that was the wrong choice, even if that was the wrong bet, I'm someone who I would rather take action than not. I would rather make a choice and move towards something than wait and see if it's going to pan out. Because, the whole wait and see thing, you're just sitting there, you're waiting, you can't actually do something. I don't feel like I'm in control of the situation. I don't feel like I am doing anything for myself, and it drives me insane. On the other side of it, the last time I was actually presented with wait and see 2 weeks ago to see if it would, close up within that 2 weeks. And right now, my biggest regret is that I didn't just go ahead and do what I was doing today 2 weeks ago, because theoretically, like, I lost 2 weeks by doing this. And, back then I thought, okay, it doesn't look that bad. There's a chance that it will come around. But, today it doesn't look any better. Arguably, it might even look a little bit worse. So I don't want to place my bets on the waited out route. And a lot of what I'm getting after going through this whole inconvenient ordeal, the tear itself, the first surgery, and now this, is everyone is telling me, oh, it's so impressive, your attitude. It's so impressive, your mindset. It's so impressive how resilient you are. It's so impressive how you aren't letting this get you down. And I think what's lost in that is, like, I didn't wake up this way one day. I wasn't born like this. I didn't just become resilient. I didn't just have this perspective. All of these things, all of those traits, the resilience, the perspective, the courage, whatever you want to call it, you have to learn them. You have to be taught them. And you can be taught them by experience, or you can be taught them by listening to the experience of others. And for myself, a lot of it was, I have had a lot of injuries. I've been through it. I've seen things. And I've also seen the other side. I've seen recovery. I've seen coming back from it. And it's that experience and seeing the whole process for myself over and over again, I've been able to not necessarily handle it easier, but handle it better and handle it with more gratitude and handle it with more optimism and learning to trust myself because I've done it before. And without having gone through it, without having, the proof that I can do it, I probably wouldn't be as positive as I am with this. I wouldn't have as much faith in myself, and I wouldn't be able to do what I'm doing and talk through it the way that I am if I haven't been there before. So it's not like I'm some, magical mystic character that just is so, I don't even know the word I'm looking for, profound in his ability to deal with adversity. I'm just a dude that's done it, and I'm doing it, and I'm continuing to do it, and I don't want to stop doing it. And that's the big, big, big lesson that I want to get to you guys, because for those of you that aren't here, for those of you who are going through something for the first time, for those of you who are going through their first injury, their first surgery, their first whatever, you will make it and you will be better for it. Going through the adversity, it will make you stronger. And I know that's so cliche to say, but that is the truth. By handling this stuff, you will be able to handle more, and you will be able to handle more and more effectively. And all it is a matter of handling it, learning from it, being self-aware through the process, and asking yourself the hard questions of, am I doing this not right, but am I doing this well? Am I handling this well? Am I panicking when I don't need to panic? Am I afraid when I don't need to be afraid? Am I being angry and frustrated for no good reason at all? You got to ask yourself those things and learn from the answers as you go, and the next time will get better. And that's really it. I'm just a dude that's in it, I'm handling it, and I'm doing my best to handle it as well as I can. So guys, I'll see you on the other side. We are back, all cleaned up, sewn up, stitched up. Things are looking up. The surgery went about as well as it could have. They just basically opened her up. They cut out all of the kind of chitty dead skin, scraped out all of the gunk, washed the crap out of it, and then put some antibiotics in, or antibiotic powder in as a precaution against infection. There wasn't any sign of infection present when they were inside of me, so I'm stoked on that, but also glad they're trying to make sure that it does not become infected, because that would really suck on top of everything that already has gone on. So glad they're being proactive instead of reactive on that front. In terms of the pec, what's cool is the surgeon was able to check out the pec and see how it's doing, and he said that it looks really, really, really good. It's healing super well, and it looks better than he actually expected. So to me, things are looking up on that front, and it really does make me excited to get this kind of stuff sorted out so that I can get back to rehab and it can get back to moving forward. Because like before this, kind of in my head was like, am I just bullshitting myself with how good it feels? Am I just trying to like trick myself into thinking that it's better than it is? Because I am like a long way ahead of schedule, and in the back of my mind, there always was this little thought of like, am I just screwing myself over? And like to have it be opened up and to see that it actually is, or not see, but have someone else see that it actually is doing well, makes me feel better about what I am doing. Not that I was really ever that worried, but there always is going to be that doubt and that, little bit of what if negative thought that can creep in your head. So again, I'm thrilled to have the pack look good, and I'm thrilled to be on, and I'm thrilled to be out, and I am thrilled to be talking to you guys. Coming out of it in the recovery room, waking up was a little bit scary, because I don't know why. I was shaking uncontrollably, like full on, like legs, arms, everything just friggin' rocking, head thrashing, and like the thing that like it reminds me closest of is when I was young, I had like a super, super, super high fever, and I had chills to the point of just thrashing everywhere, and like it almost reminded me of that, and like there was nothing I could really do about it, and it wasn't stopping, and it was kind of just like, oh no. And like I wasn't too worried about the shaking itself. Like I knew I was gonna be fine, like on that front. What I was worried about was like with how hard I was shaking, how hard I was thrashing. My fear was damaging the pack, and like it was sore sore once I kind of calmed down, stopped shaking, was able to assess the situation. But I guess it's also reasonable that it's sore in the area because it got cut open, and now that I'm sitting here, I can move the shoulder around a little bit. That worry is lessened, so, or has lessened. And on the recovery room, my goal in here right now, and my goal with every medical encounter is to be the kindest, the nicest, the most grateful patient that I can. Because on one, I am extremely grateful for the care that I'm receiving. I'm so grateful to be in good hands. I'm so grateful to have people that are here to take care of me and help me out. And I also want them to know that I'm grateful, and I want them to know that I realize what they're doing for me, and I realize how hard their job can be. And being here in hospital, like you kind of get to see how hard firsthand like nursing can be. You see how hard firsthand it can be to be a surgeon, to be an anesthesiologist, because their jobs are stressful as shit, and if I can do just a little bit to make their day better, a little bit to make them feel better about what they're doing, that's what I want to do. Because again, like what I do compared to what they do, my stuff is nowhere near as stressful, nowhere near as gnarly, but it still sucks when people are angry, they're negative, they don't want to get better, they don't want to cooperate, they don't want to listen, they're impolite, they're demanding, and I just want to be, the opposite side of that when I'm in here getting stuff done. And I'm glad to see that it at least seems to be getting recognized. I'm glad to see that it seems to be making people happy. So, doing my part to try to brighten up some days while in here. Anyways, guys, that is a wrap for tonight. Stoked the surgery went well. Stoked that I'm feeling good. And stoked that I'm going to be getting out of here soon. So, thank you so much for watching. Thank you for sticking around. And we will be back for more of these because I am currently October, November, December, January, February, March, April, May, 7.5-ish months out from a meet. So we're going to keep making that climb, guys.